Hi, Dr. Igo. Today I'm going to be presenting my meningitis case study. So to start off, my patient is patient 12, a 3-year-old girl who has a history of ear infections, and her symptoms are high fever, headache, vomiting, fatigue, and ear inflammation. There was a lumbar puncture performed on her, and when we were analyzing her CSF, it looked mostly clear. There was a very small amount of turbidity. When we put it in the spectrophotometer, the absorbance reading was 0.168, and we concluded the patient has more turbidity compared to the other patient, 422, and based on her results, we're leaning towards bacterial meningitis because of the amount of turbidity. And looking at this chart, the results, her leukocyte levels are very high neutrophils. The glucose is low, protein is pretty high, and these are all characteristics of bacterial meningitis. So some possible causes for patient 12's bacterial meningitis, it could be Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenzae, Escherichia coli, Streptococcus agalactiae, Listeria monocytogenesis, or Mycobacterium TB. So in the lab, we did some gram staining for patient 12. In this picture, we have a gram-positive purple stain. And here, I did lancet-shaped gram stain and it came out like lancet-shaped cocci and strepto chains. But it looks very red. I think the ethyl alcohol was on there too long. Okay, moving on. Here are the agar results. We did a test on the blood agar. There was growth, as you can see here, and we said it was alpha hemolytic. Then on the chocolate agar, there was also some growth, but on the Thayer-Martin agar, there was no growth. And then the pathogen that was causing the meningitis, we decided was the Streptococcus pneumoniae, because obviously the CSF levels were indicating bacterial infection. The positive growth on the agar plate, and the alpha hemolysis, the gram-positive stain with the lancet-shaped cocci and strepto chains, and since there was no growth on the Thayer-Martin agar, since it's very selective. So the treatment for Streptococcus pneumoniae, it could be treated with antibiotics like penicillin, but there is an issue with developing the drug resistance, and since our patient is very young, she's only 3 years old, it's best to give her oral liquid like amoxicillin, because the 3-year-old, it's best if they're not swallowing pills, I think. Our next patient is patient 422. She's a 13-year-old female. Her symptoms are headache, fever, rash, light sensitive, head and neck pain. There was a lumbar puncture performed on her, and her CSF report, when we were looking at the CSF, it looked very clear. There was not really any turbidity. The absorbance reading with the spectrophotometer was 0.074. She has much less turbidity than patient 12, and we're leaning towards a viral meningitis because of based on the turbidity. And here, when we look at the results, her leukocyte levels are slightly high. The neutrophils are also slightly high. The glucose level seems normal, and the protein is slightly high, which are all characteristics of the viral meningitis. And some possible causes of viral meningitis for patient 422 would be enterovirus, poliovirus, Coxsackie virus, echovirus, West Nile virus, measles and mumps, herpes simplex virus, or HIV. So what we did for this patient, we did an indirect ELISA test since her symptoms resembled viral meningitis. We tested for West Nile virus, negative IgM, negative IgG, poliovirus, which would be positive IgG and negative IgM, echovirus, which is negative IgG and negative IgM, and Coxsackie virus, which is negative IgM and negative IgG and positive IgM. And what we found, the negative IgG antibodies have a long-term immunity, and they have memory antibodies, and the IgM antibodies are responsible for early stages of immunity. So the big question here is, which pathogen caused the meningitis? We ultimately said patient 422 has Coxsackie virus. Why? Because the ELISA test showed the results were negative IgG and positive IgM for Coxsackie virus. And the CSF results match closely to what a normal viral meningitis sample would look like. So treatment for Coxsackie virus, there's no specific treatment. However, rest and hydration and isolating is what would be recommended, and over-the-counter medications to help with your symptoms as necessary. Lastly, here's my Works Cited page, and that will be all for today. Thank you.